Physiotherapy management for COVID-19. COVID-19 is a highly communicable infectious disease caused by severe acute respiratory syndrome coronavirus 2. It shows influenza-like respiratory tract infection symptoms. The World Health Organization recognized the outbreak of COVID-19 as a pandemic on the 11th of March 2020. As on 14th of September 2020, 29.3 million confirmed cases of COVID-19 have been reported and has resulted in more than 19.9 million deaths. Physiotherapists are a key element of multidisciplinary team for managing COVID-19 of the intensive care unit and active hospital services. Physical therapists, especially respiratory therapists, play an important role in managing novel COVID-19 patients. They treat respiration problems in COVID-19 patients, thereby delaying or preventing intensive care requirement for the patients. Physiotherapists are involved in mobilization, posture correction, conservative care, weaning from invasive mechanical ventilator support and post-recovery care. Physiotherapists play different role in different settings including primary care, community care and acute care. In primary care settings like private clinics, physician-shared general practitioners, emphasis is given to prevention and early identification of cases. The main roles of physiotherapists include preventing COVID transmission by following basic protective measures, promoting clinic hygiene, maintaining hygiene by washing hands with soap or using alcohol-based hand rub, avoiding direct contact with suspected patient, assisting in early identification of COVID patients, educating the patients about the preventive measures. Physiotherapist can aid in providing care at home for COVID-19 patients with mild symptoms. The role of physiotherapist is to educate the patients and caregivers, and explain care measures for patients with comorbidities, disabilities, elderly and/or reduced functioning. In hospital settings, the physiotherapist focuses on managing the respiratory symptoms. The roles of physiotherapists include giving respiratory care for severely ill patients, providing non-invasive ventilation support, clearing airways of the patient on ventilator, and positioning the patient properly. Physical therapy interventions should be provided only when there are clinical indications and significant functional limitations. It is important to assess oxygen status, cardiac and hemodynamic stability with activity before enrolling the patient. Aerosol generating procedure should be conducted in a negative pressure room, or at least in a closed, single room with a minimum number of staff, all wearing personal protective equipment. Physiotherapists must take droplet and airborne precautions, including use of a high filtration mask, when providing mobilization exercise. Physiotherapy aids in improving mobilization of severe COVID patients after recovery. Musculoskeletal physiotherapists assist the recovered COVID-19 patients return to full function.